heart's being a little fast.
Yeah, that's what I said, yeah.
I don't know what you're nervous about.
Yeah.
It's a high pressure situation.
Nice, yeah, I don't know.
High pressure situation. Alright, what's up guys? Welcome back to another video. In today's video we have two very special guests, Dr. Kelly and Dr. Han. They can introduce themselves a little bit later, but we're just going to be doing a quick question and answer while we eat some Korean food today. We have... What do we have today?
This is bibimbap, dude. I thought you told me you were Asian.
I know, but I didn't want to say it wrong. So. We have bibimbap. I don't want any Korean people to get mad at me out there. We have like
I'm not gonna try.
6 pieces of kimchi and like 6 pickled kimchi, whatever, cucumbers.
Yeah, exactly. It's just
Delicious.
different kimchi.
All right. So for the first question today is just quickly introduce yourselves and yeah.
Go for it, John.
Sure. I'm John Kelly. I'm from outside of Boston originally. Currently a 4th year cardiac surgery resident at the University of Pennsylvania.
And I'm Jason Han. I'm 1 year above John. I grew up in Jersey after being born and raised in South Korea.
All right. So what are you guys like currently up to right now?
Yeah, so both of us are on research time, sort of halfway through our residency. We get 2 years to actually develop academic interests that we want to. And during this time, and I'll let Jason speak more about this, we've been able to work on this project and really develop it sort of as a culmination of 3 years of progress.
I'm actually finishing up my research time soon. I go back to full clinical rotations in a few months. But during my 2 years, I've been able to think about a lot of questions that are meaningful to me, and I think about the job that I do. I've been writing for a newspaper in Philadelphia for the last 6 years, and each time what struck me is that there is a storytelling component to medicine that shows the humanity in it, and more and more I think it's important to get that message out there in medicine. So we started working on this project called TheModernSurgeon. It speaks to the fact that surgery often tends to be viewed as a very isolated specialty inside ivory tower hospitals, but in reality there are many components of it that could be really opened up to society that people would find very interesting and compelling, and may even find helpful when they need to navigate through their personal illnesses or those of their loved ones. So we came up with this brand that really tries to use storytelling and transparency to talk about some of the diverse aspects of surgery, such as education, maybe surgical wellness, what trainees go through, how their day-to-day lives are, and what they can do to keep themselves up with the modern times.
And we're trying to be like the Vice or Eater, or just like there's that type of like 3 a.m. you're up at like past midnight, you're trying to binge something, you watch some food videos. We're trying to make that type of video for surgery as well that just like normal people can watch and find interesting. User 5555999 says that wants
Sorry,
to
which
know.
user was it again?
There's a lot of numbers there.
User 5555999 wants to know, is it true that all heart surgeons are heartless?
John, you might want to start with this one first.
It's 100% true. No, I didn't know how to answer that.
Where did user
Yeah, where did this come from?
hear that?
Yeah, that's the real question.
Where did you,
Can we bring that on the
what
show?
heart surgeons do you guys know?
If we were to answer that question,
Yeah.
though, I don't think you can do the job if you're heartless.
I agree.
Maybe we can
Okay.
settle it there.
That's right.
Okay, on to our first question. Now, what was it like for you guys the first time you saw like an open heart, or like worked on a case with like an open heart out there?
Yeah, for me it was the first week of medical school. I went into the operating room, looked over the drape, and looked right into a pediatric open heart surgery case, and I was so mesmerized by it, mainly by the mechanics of how everything was working, what the surgeon was doing. It was something I found I just couldn't look away from and really wanted to learn more and more about.
No, seriously, that's probably what drew me into cardiac surgery too. You know, there's a really dynamic component to operating on a heart. Like, not only is it beating, blood is flowing, you can see colors change based on the maneuvers that you perform in the OR, and it's really just you're interacting with a system that is pumping and breathing and perfusing the rest of your body the way that it always does when you're living. So like operating in that area is super fun. Like before you even know it, like time flies by.
Yeah.
You blink an eye and you've been operating for 4 hours.
Now, the next question is, a lot of people have been wondering, have you ever felt the urge to just like squeeze the heart like a stress ball when you see it? A lot of people have been wondering.
Well, user 5555.
Yeah, I was gonna say, it's not like the heart was,
It's not user 5555.
Yeah, so to that point, actually sometimes you are supposed to squeeze the heart during the case. You have to sort of decompress it and actually push the blood out of it. Sometimes at the end of the case, to get it to start back up again, you actually have to flick it sometimes or give it a little push. Something I didn't really know a lot about until we started working in the OR a lot. Anything you want to add to that?
Anything you want to add to that?
Yeah, I mean, what I'll say is that it is a tougher muscle than you think it's gonna be. Or maybe you already anticipate that, but certainly the first time I touched it, I thought that even by gently touching it, I was gonna damage it in some way. But it is a firm piece of muscle. I mean, I guess it beats millions of times throughout your lifestyle, so throughout your life cycle. So I mean, it was surprising.
And anyways, from the first time you guys have operated until now, how do you think what goes through your head has changed?
Yeah, that's a great question. I think the first couple times, really in medical school, learning to sew skin together, or in residency, learning to do very basic components of cases, you're a little bit nervous, you're focused on doing everything just right and on the smallest, most, the minutiae of the procedure. And I think as you get further and further advanced, you're able to progress and think more about the whole case, exactly what you're doing, and what the next steps are, and be more present in the whole room, I would say.
And now, what would you guys say is the scariest thing you have to deal with in terms of residency this far?
Yeah, that's a great question. I mean, for me, it's definitely the night before, earlier cases or earlier years of residency when you're really learning how to do things for the first few times and you're thinking about, I need to execute this perfectly for the patient and so I can learn to be a better surgeon. And, for me, I always used to think about that, and that's really the reason that we started to develop this whole practice program to kind of get rid of that fear.
Yeah, I mean, cardiac surgery really doesn't ever let you completely relax.
Exactly.
The moment you think you have it down, you might cause an injury that permanently hurts somebody. And there's not a single operation that we do where there's no chance of that, right? I mean, even the smallest thing that we do, I think could really be devastating. So having to be alert about that kind of thing 24/7 is part of the job and the scariest part of training in it.
Now, how confident would you say you guys felt going into the first day of residency?
Is that the same user that asked that question?
Is there a zero confident option?
Yeah, I mean, that's how I felt. Medical school I thought was good for preparing me to do medical school things, but when you set foot in the hospital the first day as a resident, you have these responsibilities you've never had before that, at the end of the day, the patients are depending on you and you have to know what you're doing and what you're talking about. And at least for me, that was a big step up from being a fourth-year medical student and took a lot of learning from the first day.
Yeah, I will say it feels a lot like being an immigrant on your first day. Everyone's speaking a different language. They seem to be using different body languages or codes to talk about things. You're not really sure where to assert yourself or if you could touch anything. You're just observing everybody around you until you make sense of that world. So it was a very, very challenging and gradual process until you felt comfortable being the person saying something or touching something or initiating a maneuver or something like that. It takes a while.
I mean, I think we're still gaining confidence every day we go to work. I mean, you've been doing this for 5 years, me for 4 years, and I think even there's still things we learn every day, and we get more and more, I think, confident in our ability to treat all sorts of different things.
It still hasn't left us.
Now we just have a couple more questions left. I'm going to be asking the last serious question. I guess it's not that serious, but it's what is your guys' opinion on the recent pig-to-human heart transplant that happened?
I mean, that's a really sophisticated question. I mean, it is a milestone for the field. If you consider the fact that the first heart transplant, and those major operations have happened less than 100 years ago. And now we're looking at options where you can use an animal organ to potentially be transplanted to the human being. It completely changes the game of the field. I mean, imagine that somebody is sick and instead of needing to go through a really, really tough operation just to fix one component of the heart, now you can replace the whole thing. And now imagine that you can produce it at a scale that could be used in everybody. Obviously, this is a complicated scenario, both logistically and ethically, but I think when that happened, a lot of people around the world thought, wow, I can't believe we're this far ahead already.
Right, so now we just have a handful of maybe simple, but they could be the hardest questions of the day actually for you guys. So we know that people who want to be heart surgeons, they have to be pretty smart, So I'm going to show you guys, I'll put it on the screen. So, what does this EKG say?
Doesn't look good. I mean, that's. Should we call cardiology? You think?
I think this might be that pig heart that we're just talking about a second ago.
All right, so that's the answer we got in terms of that. Okay, last question.
More questions.
Might be possibly the toughest one after that tricky EKG question, but they did a great job. To look up that question, I looked up an impossible EKG. I think everything else like just looks bad. Like there could be like I don't know torsades, but like you can guess it. It just doesn't look good.
That's right.
But I had to look up one that was impossible. Okay, so the last question is: so you guys work a lot with the heart. So this is not medical advice, but is there anything? Do you think there's anything wrong with my heart?
I mean, I'll take it. Listen to you. Let's see. I'm gonna when's the last time somebody's heart? Let's see what we got here. Which way does this go again? A little fast, otherwise sounds alright to me.
Yeah, all right, yeah.
This one pulmonic valve. You gonna listen here, huh?
It is a little fast.
I guess there is that question about whether you're heartless or not, right?
Yeah. I should be listening to your guys then. I'm not a heart surgeon, so we know I'm not heartless.
Your heart's being a little fast.
Yeah, that's what I said.
I don't
Yeah.
know what you're nervous about.
Yeah.
It's a high pressure
Pretty nice,
situation.
yeah, I don't know.
High
Maybe not,
pressure
yeah.
situation. Anyways, thank you guys for watching this, and once again, go check out our new page. I'm gonna link everything down below. I think it's really gonna be stuff that you guys would be really excited to see. And thank you so much, Dr. Kelly and Dr. Han, for agreeing to be on this. And I think if you like this video, leave a comment down below, like, comment, subscribe, and we'll see you in the next one.